So basically, preventing cancer cervix prevention is done at three levels. The primary prevention, where we want to prevent an HPV infection at all. Okay. So then there is the management here is twofold. One, that they would promote good sexual practices. So basically, behavioral modification. The other, which has now come up, is the prophylactic vaccines. Okay. Then comes the secondary prevention कि अब infection तो हो गया है, but at least we pick up the precancerous lesions and treat them. Then is the tertiary prevention from mortality, so treatment of the precancerous and the invasive cancer lesions. Pratmesh has asked, why screening with cytology at 21 but HPV at 30? That's logical. Yes, yeah, because HPV, many of these people will clear HPV infections. We said ना कि HPV जो है वो sensitive तो है ना, बट स्पेसिफिक नहीं है, क्योंकि बहुत सारे पेशेंट्स ने एचपीवी इन्फेक्शन क्लियर ही कर लेना है बाय 30 years of age. It is not going to persist. It is only the persistent HPV infection which we are worried about. So that is why अगर 30 के नीचे हम HPV करने लगेंगे तो सबके ही आते जाएगा पॉजिटिव. So that is why it is not done before 30. We would have talked about it later, but since you have asked it, I'll tell. ठीक है. So if at all you have to do something at age of 21, you can go for cytology. If you are very worried that this patient had, especially in the sex workers and those class abused patients who have been abused, in those class our HIV also 25 पे हम शुरू कर ले advise कर देते हैं, because they are at a relatively higher risk. But HPV is not recommended before 30 because a lot of people will clear out those HPV infections. So those we need not to worry about. ठीक है. अदरवाइज हम तब से HPV कर लेंगे तो फिर आगे ओवर ट्रीटमेंट एंड ट्राइजिंग हो जाएगी. HPV, yeah, HPV detection will be earlier. This was not from the slide that I showed. This is showing the timeline of how the HPV infection finally leads to CA cervix, not the timeline in age of the patient. Okay. So first step is definitely HPV infection, but anybody who has a sexual debut before 30 years may get infected with HPV, but a patient with a normal immune system is likely to clear it by 30 years. तो जो 30 के बाद persist होते हैं, those are the ones which we are worried about. ठीक है. तो इसलिए हम less than 30 पे HPV नहीं करते हैं. Okay, so primary prevention, two-pronged, behavior change and vaccine. So, okay, just to see if you are awake. All of the following are risk factors for cervical cancer except multiple sexual partners, HIV infection, smoking, bacterial vaginosis. A, B, C, D. Oh, ये सारे A क्यों लिखे हुए हैं? Understand? Take it as A, B, C, D. I don't know. I didn't check. Okay, no, actually, bacterial vaginosis is what? It is just an imbalance of the normal bacteria, right? So it's not a STI as such. Okay, so out of these, this is the least likely to be associated. Okay, it's not chlamydia, it's not herpes, that kind of, right? So again, behavior education will be by basically preventive strategies aimed at preventing STIs. So high risk behavior and high health education. Okay. So at least early age at sexual contact, multiple partners, unprotected sexual intercourse, low socioeconomic status, low education, multiple childbirth, smoking. So by education and increasing awareness and increasing barrier contraceptive use and less earlier marriages. So these are the things which can help in prevention of CA cervix. Then comes vaccine. So when vaccine comes to the mind, there are a lot of questions that come up, what is the efficacy, what is the safety, what age group to use, how many doses to give, which vaccines to give, and whether somebody who has got vaccine requires screening or not. Okay, so we'll answer some of these questions related to the vaccine. Already, if somebody has CIN, whether to be given to males or not. Okay. And before we go to the vaccine, we must remember this name, Professor Harold Zur. He was awarded Nobel Prize in Medicine 2008. He uncovered the connection between HPV and cervical cancer. So without his work, maybe there would have been no vaccine and nothing to prevent it. Okay. And Professor Ian Fraser, who produced the first vaccine. So two names that you should remember in relation to this. So the commonest vaccine now available is the quadrivalent Gardasil. which is designed to protect against new infections with HPV 6, 11, 16, and 18. And we understood that these were the low risk, जो anogenital warts वगैरह कर रहे थे, and these are the two high risk ones which are responsible for 80% of cervical cancer. ठीक है? Initially, there used to be Cervarix also, which was bivalent, but now this is relatively less available and not recommended. And the newest one is the Gardasil 9. In addition to 6, 11, 16, 18, it has 31, 33, 45, 52, and 58 as well. So protection against more genotypes. This will be protective against more than 90% of cervical cancer is covered if you get this one. But definitely the cost factor comes into picture. It's almost nearly 3 times the cost of Gardasil, the quadrivalent vaccine. This is about 4,000, this is about 12,000 per dose. Now, the Serum Institute of India has made a similar quadrivalent vaccine to Gardasil, which is now called as Servavac, approximately 2K per dose. And it is very similar to the Gardasil, the quadrivalent one. So, like we saw what all we need to know about the vaccines. So immunogenicity is 100% if they have looked at the antibody formation. Every patient who got the vaccine had some antibodies. Okay. Now, efficacy can be checked actually only by seeing whether these patients develop cancer cervix or not. But since that kind of efficacy will take a long time for a study, right? So CIN2 plus has been used as a surrogate. So again, it was seen that near 100% protection for against CIN23 was seen for at least 8 years, 75% in HPV 31 related, and again 100% vulvar vaginal precancer and warts were protected using these vaccines. It's very safe. There are only minor local side effects like swelling, pain, erythema, or minor systemic solicited reactions like fever or nausea. No serious event has been reported, no deaths have been reported as such. So if somebody asks you, then it is definitely safe. Some precautions should be taken. So they can be administered to patients with minor acute illness, but if there is a moderate or severe illness like a major fever, cough, then you need not to give it. Okay. And contraindications in patients, only one thing you need to ask if they are hypersensitivity to yeast cells में जो L1 capsid बने होते हैं उनसे recombinant उससे बनती है, so yeast allergy has to be ruled out. So AIP, Foxy, API, everyone is recommending vaccine, but the choice of vaccine, whether to use the quadrivalent imported one or the Indian made one or the non-valent one, depends upon availability as well as affordability. Plus, you can counsel that although the quadrivalent will also protect against 70-80% of cancer cervix, the nonavalent can protect against 90% of it. But of course, we have to see the cost benefit ratio. This is not the only cancer that you have to prevent, okay? So interval 0 to 6, so basically 2 doses are given at less than 15 years. So 9 to 15 years is the age where we give, which is the recommended age. So here you give 2 doses, then it is 0 to 6 months. 3 doses are given for more than 15 years of age. And then the extra dose is the 2-month one. Okay, whether quadrivalent or nonavalent. But this is the recommended age. So if people have missed here, then catch up vaccination from 15 to 26 years. But you have to counsel them that the efficacy may not be same as much as if you had received in the young age, and you must continue screening. Okay. Then again, for older age groups, if patients will come to ask you someone, then also you have to tell them that you have to get 3 doses, but the efficacy may not be as good if you are already sexually active, right? And again, in limited resource settings, rather than vaccinating this group, it's more important that we invest in their screening. Okay? So countries like UK, Sweden, Denmark, they have a very active HPV vaccination program, but they are relatively more affordable also. So we have to consider ours. So if we have a limited amount of money to spend, rather than vaccinating the older age group, we can concentrate on the screening. whereas we can concentrate on vaccinate the younger ones. Now, some special considerations in HIV patients, you have to get 3 doses irrespective of age. So whether you are young or old, it doesn't matter. And suppose you get 1 dose and then forget about it, then you don't have to get all 3 or all 2 again. You can just start from where you stopped. Suppose you get pregnant, you got 1 dose, got pregnant in between. Even then, you can advise the vaccine. The second and third doses later. And again, during pregnancy, it is not to be used, right? But can be given in lactating or postpartum women. But in case it has inadvertently been given while somebody has early pregnancy and didn't know, it's not an indication for MTP, so it's not teratogenic as such. And so before checking, so there is no relation to menstrual period when you need to give it. There is no need to test for pregnancy or already to see whether you are infected with HPV or not. You can get the vaccination irrespective of these tests. Okay. Plus, even if there has been history of abnormal cervical screening, vaccination can be given because suppose somebody tested positive for HPV 16, maybe, right? But you give the vaccine, it will still protect against the other genotypes. Okay? So again, it can still be taken, but the patient has to understand that it is not going to be as beneficial as it will be to a HPV naive person. So then that again depends upon the cost effectiveness. Okay. And they have to undergo the same screening protocols. तो ऐसा नहीं है जिनको वैक्सीन लगी है वो लेट से स्क्रीनिंग करेंगे या उनका इंटरवल ज्यादा होगा, ऐसा कुछ नहीं है. So that's going to be the screening with the PABs or HPV DNA or via whatever modality, that is going to be the same. So yes, postpartum vaccination is coming up in a big way. So after delivery at the 6 weeks visit, it is offered to the patients. Again, with the caveat, because postpartum patient has already had a child, will most likely be above 26 years of age. So you have to tell them it might be relatively a little less effective, but it is still preventive. So vaccine for males, okay? So why males, first of all? As the secondary target group, because males also have HPV related cancers like the anogenital oropharyngeal cancers, especially the men having sex with men, plus for herd immunity. You understand, I think you understand herd immunity from your community medicine. So basically, if the virus pool will decrease in the whole population, because males are also going to be carriers of HPV. So that way also it will benefit the females finally. Okay. But in India, since the studies have been done only on Cervavac, and it is the relatively cheaper one, so it is the only one. Studies on boys have been done in India for Cervavac only, so it is approved for only Cervavac. The Serum Institute made one is allowed for boys, not the Gardasil one. And yes, so we talked about 2 dose and 3 dose. There are actually single dose vaccine trials also going. So studies, almost nearly 12-year follow-up of an IARC study has shown that even 1 dose works. So where you may think, that affordability is less or resources are less, at least we can start giving maybe 1 dose also. And this is the latest in 2015, the FIGO, 2025 June. FIGO has released a position statement on effectiveness and safety. So whatever we have discussed now is covered in this.